this morning's seminar series. RCC and Jordan's principal has kindly extended the invitation to include us, to include Breakfast at Sky for this morning's talk. We would like to begin by acknowledging that we are on Turtle Island and that this is Treaty 1 land and the traditional territory of Dakota, Anishinaabe, Cree, Oji-Cree, and Dene peoples, and the homeland of the Métis Nation. Before I turn over the presentation to my co-host Pam Becker, I just want to quickly review some items. So asking that everyone stays muted for the duration of the talk, and please feel free to enter any questions that you have into the chat box, and I can certainly relay those questions at the end. Or if you prefer to unmute yourself at the end of the talk and ask questions directly, that would be welcomed as well. So today's topic is evidence-based optimal support for transgender youth, presented by Dr. Simon Pickstone-Taylor. And so now I'd just like to turn it over to Pam Becker for the bio and more introductions.
Thank you so much, Liz. I am very excited to have Simon join us today. I first met Simon, I think it was 7 years ago in South Africa, and had the opportunity to visit with him and see him again on another trip there, and then see him when he was here in Winnipeg. And that was the first time we started talking about this, and I learned a lot in a very short conversation. And so I am very happy that Simon has agreed to present for Breakfast at Sky for us today. And so Dr. Pickstone-Taylor grew up on a farm near Cape Town in South Africa. He did his undergraduate medical degree at Cambridge and then finished in medicine at the University of Cape Town. He went on and specialized in psychiatry in the United States and did a fellowship in child and adolescent psychiatry at the University of California in San Francisco.
It must be a system thing though, because there's an exclamation mark on
If you don't mind. That's great, thank you. He worked for the National Health Services in the United Kingdom for 7 years and then returned to South Africa in 2000. He works with inmates for the Department of Correctional Services and has a part-time private practice at the Neurodiversity Center that specializes in autism spectrum disorder. He also has a special interest in gender diversity, particularly young people. And in 2012, started the Gender Identity Development Service within the University of Cape Town's Division of Child and Adolescent Psychiatry, where he provides for support for young people and their families, as well as support to other professionals supporting the children he works with. He's an honorary senior lecturer in the psychiatry department.
I recognize that Simon guy.
And gives training on gender and sexuality to trainees and staff. He is a member of the World Professional Association of Transgender Health and an advocate against the pathologized, sorry, Simon, I can't do it. I'm going to let you do that, but is an advocate for children with gender diversity. So I am just thrilled to have Simon here and would like to welcome you to the talk. Thank you.
Well, thanks very much, Pam, and thanks all of you for being up in the morning and listening to me. This is an area where a lot of people didn't have any training in gender diversity in young people, and I hope that this talk will be helpful. Please feel very free to ask me whatever questions you have. I think it works best to go through the talk that I have and then questions afterwards, but you're also welcome to send questions during, so you don't forget, certainly. But please feel free to ask the prejudice questions because those are the best ones. This is an area where I have worked for a long time, but it is new to a lot of people. And it's the things you're worried about that often are the best things to ask about. So yeah, you don't have to put your name on them, and hopefully we'll get to them. So today I'm going to be going through what I think will be the helpful things to cover. And as you OTs, I'm not, I think you're mostly occupational therapists, so I'm not going to dwell too much on the psychiatry bits. But I'm happy to go into more detail of anything that is helpful for yourselves, and particularly if I'm missing that, bring that to my attention. So firstly, I'm going to talk about gender terms. You know, what are we actually talking about? Then the incidence of transgender, the so-called causes of gender diversity, and just briefly touching on diagnoses, but as I said, that's more of a psychiatry thing. And then what other problems also occur in people that are gender diverse? And then most importantly, what do we actually do about helping young people, and what are the guidelines in terms of what we should be doing? So this is a slide of the gender-bred person, and I'm not sure how many of you have seen this before, but it's certainly very accessible online, and there are many different versions. And for some people who know a lot about gender, this is a very simplistic version, but for most of us, this is a good starting point. When I was growing up, certainly South Africa, things were incredibly binary, and you were male or female, and that was basically the end of the story. But we know today that gender is a lot more complex, including from a scientific basis, you know, more complex than just male or female. And the important principle is that there's a spectrum. While most people might fall onto the poles of the spectrum, in terms of the next four things I'm going to be talking about, there is a spectrum, and not everybody does. So firstly, biological sex on the outside, which is kind of what your body is on the outside. We call that biological sex. But even that is on a spectrum. While most people are born with a male or female body outside, I work with young people that are intersex. Those are kids that are born with bits of both male and female bodies. And I help them and their parents think through and make decisions that hopefully are going to be helpful in terms of what to do or what not to do, which is usually the most important thing in terms of biological sex, and perhaps changing that in young people in terms of the bits and pieces they're born with. Then we have gender expression, which is really how a young person might come across in the world, and their preferences, things like toys they might play with. Do they prefer to play with boys or with girls? And how they might like to dress. So a typical girl who has more typical male gender expression would be called a tomboy. Anybody want to volunteer what in Canada a boy who has more typical female gender expression is called? Well, most of us realize pretty quickly that usually in most cultures, there isn't a nice word. Perhaps sensitive is the nicest term, but more likely on the playground, you would be called gay or something derogatory. Which starts to give you an idea that even from a young age, many kids are already sensitized to these things, and already some of the negative vibes towards males who have more feminine gender expression comes to light. But it is on a spectrum. And I don't know how many of you women are wearing trousers today, but certainly 100 years ago, women wearing trousers was totally unacceptable. Certainly wearing a suit was quite a scandal in society, maybe 120 years ago in Canada, but out here in South Africa, even 100 years ago. But that is just a preference for gender expression. And increasingly our world, particularly for women, are fine with variation and diversity with that. Then we have sexual orientation, which of course is also on a spectrum, all the way from being attracted purely to the same sex to the opposite sex. Bisexual isn't just gays in the closet, although the truth is that at school level, often it is, because young people find it easier to say they are bisexual than homosexual. But certainly there are people who are attracted to both and somewhere on the spectrum. But really what I'm going to be talking about today is gender identity, which is separate from those three other axes I've just gone through. And for most people, this is a pretty weird thing because most of us are born with a body that is in line with our gender identity, our sense of what our gender is. But there are people who are born and don't feel their body on the outside is the same as their gender. And that's really what we're talking about, which is in your brain, the sense of are you male or female? And most kids or people will point to their brain when they talk about, you know, being male up here, even though the body is female, or vice versa. Gender identity develops very early on, between the ages of 2 and 3 years old. So this is a very deep-rooted thing. Sexual orientation, however, for most people only develops between the ages of 7 and 8, so quite a bit later on in a child's development. By the way, this slide, the genderbread person, as I said, you can easily find it online. This is probably the most helpful slide, and often it's a useful one to show parents, or if you are wanting to use this as a teaching tool, or just to understand. Each and every young person I meet, I will go through these 4 axes with them to understand who they are. And most young people are very clued up in terms of who they are if they are gender diverse. All it takes is providing the right environment, and I tell each one of them, having said a few terms before to their parents, that the smarter ones, or even not so smart ones, will pick up immediately that just using the term gender diversity, for instance, will immediately signal to many young people that I'm open to whoever they are. But I'll certainly tell them that I'm not there to change them, just to understand their gender and to help them be accepted by their parents and be allowed to be themselves. So, cisgender, which often people haven't heard of, is what most people are, CIS gender. That means your body is in line with your gender identity, whereas transgender generally refers to it's somewhere on the opposite, 51% and plus. But the truth is with these terms, it's always helpful when somebody says, for instance, I'm transgender, is to ask the person what that means. It's not disrespectful. And in fact, most transgender people are very happy to educate their cisgender colleagues in helping to understand things. But for some people, transgender might be 100% the opposite gender, and then they might rather call themselves gender queer if they're somewhere in the middle, or just say they're somewhere on the gender spectrum. But each and every child I see, I will put up my hands and say, if this is 100% male and this is 100% female, where do you think you fit in on the spectrum? While most fit in on the ends, they often fit in somewhere in between. A helpful way to start with any client in terms of gender is to ask them what name and pronouns would they like you to use for them. That immediately signals to them a huge amount of information in that you are open to the fact that they might not be typically gendered, and that you wish to be respectful and you know, respect whoever they are and how they identify. And even if they don't tell you the name that they want or the pronouns that they want, certainly in my job, they often don't do in front of their parents, it will immediately signal to the child that you are open to changing the name and pronoun to the ones they want if they feel safe enough. And as I say, if you don't know something or don't know the term that you think you should know, feel very free to ask your clients. Even young children are abnormally advanced in terms of understanding gender, and they love to teach grown-ups about this, even more so with teenagers. So what is the incidence of gender diverse kids or transgender kids? It was thought to be extremely rare, 1 in 10,000 for trans girls. Those are birth-assigned boys who identify as females, and even rarer for trans boys, 1 in 30,000. However, today, we know this is not the case. It's looking like 1 in 200. That's really high. That means every sizable junior or high school, or I'm not quite sure what you call them, maybe they're middle schools, or maybe that's American, but essentially each school is likely to have some transgender youth in them, and it's something we need to be aware of and know how to support them. We think the reason for this dramatic increase is the internet and media. Now, before you rush home to switch off the Wi-Fi, in case anybody catches it, really what is happening is younger people are recognizing who they are. They have the feelings long before, but they're recognizing who they are at a much younger age, and they're coming out at much younger ages all over the world. And certainly that's what I'm seeing in and around Cape Town, where when I started the clinic in 2012, I saw maybe 1 patient every 6 months. I'm now sometimes having 3 new referrals a week. There's an explosion of these young people, and my colleagues all over the world are seeing the same thing at their clinics. As I said, most are wanting to be, identify as the opposite sex, but there also is the spectrum with young people being genderqueer. Very importantly, I feel, is this issue of causes. And the reason it's important is because of prejudice. Originally in psychiatry, psychiatrists and psychologists did used to think it was the parents' fault. And sadly, about the first 20 years of research was all done into what did the parents do wrong? How come they reared this child that identified as having a different gender? Sadly, a lot of this research happened not too far away from where you are. In Toronto, and but we can speak about that later. But unfortunately, it was a backwater, and people doing the research in this area weren't really well known in the rest of medicine, or I think there might have been a bit more concern. The same issue was in schizophrenia originally. Mothers were blamed for being overly close and fathers for being distant. Once it was proved that schizophrenia is genetic and 1% of all communities, all races have schizophrenia, they moved on to gay and lesbian kids. And once that was proved to be nonsense, it moved on to this backwater of transgender kids. Ironically, the research today for me is actually quite helpful. It was about 25 years of research looking for what the parents did wrong, showed absolutely nothing. So they would look at families with maybe 5 daughters, and the last one, the youngest, was transgender. And did the parents perhaps do anything different because they really wanted a boy? And overwhelmingly, the literature has proven that it has nothing to do with parenting. I make a huge meal of this because it's a very important message to get out there. Many parents feel themselves that perhaps they did something wrong and have labored, resulted with a child that then has to deal with this for the rest of their life. But even if the parents know they did nothing to push their child in any direction different from their birth-assigned sex, their own parents might blame them, or their neighbors, or their colleagues at work. You know, they're vegans, so probably they did something else evil. There are a lot of prejudices there, school teachers. So this is a point I tell everybody because all of that pathologizing research really makes it very clear. So where does it come from? Our first hint that it was biological came from something called congenital adrenal hyperplasia, which essentially are women carrying a female baby, XX chromosomes, but they happen while they're pregnant to have a much higher level of testosterone, typically what we think of the male hormone. Now, it's not like women don't have testosterone, and it's not like men don't have estrogen and progesterone. We all have all of these hormones, and they can even be converted into each other and are in our body. But it's the relative level of hormones at what time. Now, those women give birth to female babies, the ones who've had high levels of testosterone, and they have slightly enlarged external genitalia, but they grow up into being normal sort of looking females. However, a much higher proportion of them feel they're really male, not actually female, so transgender men. And that was the first time when that was described and thought about that doctors thought, well, maybe it's not just the parents screwing up the kids. Maybe this is something biological related to the hormonal levels in utero. And today there's a lot of research done into the differences between male and female brains. People are really fascinated. And female brains aren't pink and male brains aren't blue, but there are a few differences. And the sort of things we're looking at are the sizes of the different parts of the brain, blood flow, and connectivity. So while most of the different parts of the brain are roughly the same in males and females, there's certain parts that are either bigger or smaller, depending on whether you're male or female. And there are statistically different sizes and differences. So there's a typical female brain pattern and a typical male brain pattern. And guess what? If you take a group of transgender women's brains and compare them and do their patterns, they follow the typical cisgender female brain pattern. And the vice versa there is also true for transgender men. Now that's huge, because what that is telling us is that the brain pattern of a transgender woman's brain is likely to be female. And it's kind of sad that we've had to wait so long and people couldn't just believe transgender people, that they felt really their brains were not the same as their bodies, as in gender. But we have science today showing exactly that. And similar evidence is coming out now in terms of blood flow and connectivity in the brain. But it certainly has big implications in terms of human rights and the fact that we need to really listen to people, because people know their gender identity. They don't need a brain scan, by the way, to tell them that. And also it is a curve. So there are 5% outliers. Some of the parents ask me, well, can we now do a scan on my child just to make sure? And I have to explain to them, A, it would be very expensive, and B, the father's brain might be a 5% outlier and falls more into the typical female pattern, which doesn't mean I would then ask them to have a sex change or do anything else. People know their gender identity, but essentially this data is helpful for some people. I'm not going to spend a lot of time on the two major diagnostic categories in terms of gender identity, but enough is to say that the American system, the DSM-5, is the latest version. All of their diagnoses are part of mental health. So sadly, it still is a mental health diagnosis in terms of DSM-5. In terms of ICD-11, which is almost kind of confirmed now, that's the International Classification of Diseases, it's been moved outside mental health because the ICD cover everything, including pregnancy. So it's a lot less pathologizing. Even transgender people on the whole do accept that they have a diagnosis as an adult because they need access to care, but they don't want to have a mental health condition, particularly as in certain parts of the world, the fact that they have a mental health condition allows people to incarcerate and certainly put them in mental health institutions and take away their rights based on the fact that they have a mental health condition. But I can talk more about diagnoses if anyone has questions. But in general, the trend is to depathologize, to not make gender diverse people's lives more of a misery than the world already makes it by giving them unhelpful diagnoses. In terms of young people, what other conditions might they have along with being gender diverse? Typically, the younger kids have somatic problems, headaches and tummy aches in younger children. And that's not just for transgender kids, but kids with any sort of problem. They don't present with anxiety or worries about something. They just have a headache or a tummy ache, which really is there. They are experiencing that pain, which is very important to remember, not to dismiss pain or headaches or tummy aches and say, well, you couldn't have one. Because actually the nerve endings and the way that they relate to the brain are different in those kids, and they really are feeling the pain. And one should be looking at what is going on for a child that constantly has somatic problems. But as they get older, perhaps more emotional and behavioral problems, transgender boys might have a lot of fighting with their peers, be very aggressive, and school refusal is a big one. These kids are horribly bullied either by peers or often by their teachers and not their peers, not always, but often. And they might just decide school is awful and they just refuse to go. They might hate having to put on a dress, and that might be one of the reasons they refuse. But as they get older, full-blown anxiety and depressive conditions result. And in fact, with the depression, if they're not given the right supports, 50% of them have been shown to try and kill themselves before the age of 18. And that's what makes this area so serious. We have nothing in psychiatry where a relatively small group of people with a known situation, 50% of them try and kill themselves. So this is a very serious situation, and I think helps one understand why seemingly radical protocols were called upon to help these young people. So what do we actually do with transgender youth to help them? In the past, psychiatry, as I say, used to blame the parents and give therapy to these young people to try and change their gender identity. And that is understandable. I mean, if it's possible to make a child okay with their body and to stop loathing it or being very distressed by it, I think most parents would rather give their children therapy and to not have them take hormones or do anything else to change their body. However, the problem is it doesn't work. Therapy to change sexual orientation or gender identity has been shown in all the studies that are on it, it simply doesn't work. And in fact, it's seen now as a form of abuse. Sadly, in Ken Zucker's unit, and I can say it safely from South Africa, I'm not going to be fired, but his unit in Toronto for years practiced appalling therapy. And in this industry or, in this world, there are many people who know what happened from his and other treatment centers and how damaging it was to be told over and over that you need to change something. Many kids aren't stupid. They pretend that it is changed in order to be accepted by people, but 5 or 10 years later, they're still the same people they were. And it's very unhelpful and breeds low self-esteem and all sorts of other problems to be told that something that is part of you has to change when you can't change it. So what do we do to help these young people? There's an organization called the World Professional Association of Transgender Health, or WPATH, that essentially has collected the evidence from all over the world of what does and doesn't help. And there's been a dramatic increase in the amount of evidence we have in the last number of years, last 10, 20 years. And these standards of care being listed here are from 2012, but hopefully in 2021, we will have the updated standards of care. Not that anything is going to change radically, but from what I'm telling you now, I don't think. And these are based on science. And everything I'm telling you is based on evidence-based medicine. And I think that's vital in this area, to stick to what we actually know. In general, in medicine, we should be doing that anyway, or I should as a doctor, and all doctors should, and I'm expecting that you would have the same thing in OT. However, in this area, it's really important to do this and not to give one's opinion based on the last 3 people you see, and to be very clear with parents. Parents don't want to have opinions. They want to really know the science, because the treatment is radical, and they don't want to be doing these radical things without knowing there's very good evidence that it is helpful. So what do pre-adolescents need? These are kids in junior school before puberty. The families just need psychoeducation and support. It's not quite a just, but I usually do a big one-stop shop of about 3 hours, because spreading this out over weeks is kind of agonizing. Once you get into this issue, it's really important to help the parents have answers to things. And I can talk a bit more about the sort of 3-hour assessment that I normally do. The children themselves just need observation and support. I've never sent one of the kids I've seen for therapy. All they need, though, is the world around them to allow them to express themselves as freely as possible, including at school. Now, this is the controversial thing. They need a social transition. So if they identify as a girl, they should be allowed to express themselves as a girl. And I'll go in a little bit more detail in the next slide. Young people pre-puberty do not need any endocrine, no hormones, or surgical interventions. Occasionally, you'll see some sensational article saying doctors are giving children hormones. Certainly, no one gives anybody hormones until they're in the 2nd stage of puberty, as I'll talk about just now. So social transition. In terms of school, it's kind of the obvious things. They want this at home, but they also want it at school. They want to change their name and pronoun, very important. Sometimes they're happy if they've got a unisex name to keep it, but often even if they are called Alex, they still want to change it because the name is associated for them too much with their birth assigned sex. If the school has a uniform, they'll want to change the uniforms, toilets, changing rooms, and sports. Of course, it matters, you know, if there are uniforms and what is happening at their school, and this needs to be talked through. Also with children, it's very important to take the lead from the child, not for me to say, okay, I think you're transgender, you need to change all these things. Kids aren't stupid, and they've usually thought about all of these things as well, and they might only be ready, a young child of 10, to change their name and pronoun and see how that goes. But increasingly, as they get older, they usually do want to change all these things, and particularly with teenagers, the social transition is what they want, usually all of these different things. Any idea what for schools are the most challenging of this lot? And tell me if it's different in Canada, but certainly in South Africa, the 2 most challenging are toilets and sports. Everyone, including Donald Trump, is very worried about the toilets and concerned that something is going to happen in the toilet. And with these sort of issues, it's very important to work out what are people really worried about, what is going to happen in the toilet. And essentially, for most people, when you peel it back, parents worried about their children going to the female toilet with that transgender girl or with that birth assigned boy. They are worried that their child is going to have sex with the transgender child in the toilet. Now, one needs to look at what's going on. Firstly, transgender youth usually have a high amount of body dysphoria about anything that labels them as their birth assigned sex. So they are disgusted by their genitals and any sexual organs that, and frankly, most of them, even, the teenagers, they don't masturbate because they are so disgusted by their own sex organs. Even if they are lucky enough to have a relationship in their teenage years, they usually will not let their partner even touch their breasts or their genitals because they are so disgusted by them. Secondly, most transgender youth don't want to be the transgender boy or girl. They just want to be a boy or a girl like everybody else. So if they are lucky enough to be in an environment where they can choose the toilet that they identify as, they just want to go in the stall, have a pee or whatever, and leave. The last thing they want to do is to draw attention to the fact that their body is not in line with the label over the toilet. So as I sometimes say, another child is more likely to be hit by a meteorite in the toilet than to have sex with a transgender young person. Gay and lesbian kids have had to use the toilets with people they find attractive for years, and nobody teachers saying, but what about the boys? How would they feel if they knew, a birth assigned girl was going past the urinal? Well, they're gay people in the toilets. And and we don't tell them not to use the toilets. Often using that sort of comparison helps people to start to realize that actually these are just assumptions and prejudices. In terms of sports, the worry there is that, for instance, a transgender girl will beat my daughter in the 100 meters race. And again there, I think it's important to unpack what is going on, this unfair advantage, particularly if it's a transgender girl. Well, in my view, to start with, most transgender kids do not want to play any sports at all. They are totally revolted by their bodies and so ashamed of them, even if other people don't find them offensive or upsetting, that they won't even for PE get into sports clothes. And they will do anything they can to stay out of the sports arena. However, if somebody is brave enough and wants to put on PE clothes or run in a race, and many of these kids, I do see them straight from inpatient units where they've tried to kill themselves. Many of them are suicidal and deeply distressed. And actually, sports is a very healthy thing. And I would argue that school is about preparing kids for future life and learning to exercise, to burn up unhelpful chemicals or byproducts of stress is really important. We should be teaching kids, and I'm a little bit unsure how much sports happens in North America and Canada as part of schools, or whether it's an outside club, but it's a healthy thing to exercise both physically and mentally. And I would argue that high schools and junior schools should be teaching all kids to do that. It's not about who comes first in the race, but it's about everybody competing and developing a healthy lifestyle. I'm not arguing on a provincial or state level in terms of competitiveness or internationally. I'll leave those arguments for somebody else cleverer than me or more involved, but certainly on an individual school basis, I make a big push for people to accept transgender kids to be allowed to participate in the gender of their identification. And in terms of changing rooms, again, these kids just go into the stall, they do their thing, and they move on. They are not interested in misbehaving. It's the cisgendered kids, and usually the heterosexuals, that cause the most problems, but it's certainly not the transgenders. So I've talked about children, and just to mention that prepubertal children who've had all sorts of problems for a very long time, what I see and what is well described is that the minute, the same day that the family around the child accepts them for who they are and starts allowing them to be themselves, all of their problems go away literally the same day. Many families have seen that. They've had a daughter who's begged their parents to allow her to wear her brother's clothes and to be called John and not Jill. And of course they say you can't do that. But eventually they go away to some campsite on holiday and the mother just gives up and says, well, you do whatever you want. And suddenly they see a different child, a child that's been oppositional for years and fought and made life a misery within the family. And in fact, they weren't even looking forward to going camping because they were so fed up with this child. Suddenly they see a new child. The other boys at the campsite don't know this child and think it is a boy because, you know, she's already managed to cut her hair short and can pass as a boy. And they see this child beaming with happiness, engaging in everything, and they know it's the right thing for their child. But then they have to come back to the big city and get their child back into a dress to go back to school, which is when they come and see me and they want help with knowing how to manage things further. But what do we do for teenagers? And teenagers have this big problem of puberty. As I said, 50% of them will try and kill themselves if they don't get any proper supports. And certainly in the past, any hormones and surgery, you would need to wait until you were 18 in order to get those. Some people don't really understand this. Why should these young people be this distressed? And I would encourage you, if you are female, think about how you might feel if you got up tomorrow morning and you started to see you were growing a beard. And each day you got up, this beard was getting more and more, and you knew there was nothing you could do to stop it. And if you're male, think, how would you feel if you got up and you started to see these boobs growing? Not just man boobs, but serious breasts. And this just would carry on and on. And nobody around you seemed to understand why this was so distressing to you. They all just said it's part of life and, you know, that's just who you are. Well, going through puberty with the right body is enough to make many of us suicidal. But I can assure you, most of us would be suicidal of just 3 days of those things happening. For most of these young people, they can't even tell their parents about how distressed they are, or their close friends. It's incredibly upsetting and deeply, deeply disturbing. And so, as I said, originally, one had to wait until you were 18. But more realistically, what happened to people is they had to wait until they were 30 or 40 years old, once they'd earned enough money to afford the hormones and the surgeries to bring their bodies in line with their gender identity. Now, unfortunately, if you wait until you're 30 or 40 years old, your body has really changed considerably, and it's much harder to change to pass as the gender identity that you identify as, which is the really important thing for transgender people. They want to be recognized and treated as the gender identity they identify as. And so what happens is most people hang in there and don't kill themselves or do anything after 18 necessarily, in the hope that one day they will eventually pass as male or female. Unfortunately, about 50% of them will look somewhere in between male or female. So they don't fully pass as a man or a woman, and that condemns them to a lifetime of abuse going forward. The lucky ones look totally male or female, but as I say, about half look somewhere in between. Now, people don't want somebody like that teaching their children or being on front of desk at a hotel. And so they don't get work. The reason so many are sex workers is not because that's their chosen profession or there's some link with transgender. It's because nobody will give them a job. And if they just walk down the street in South Africa, people will scream moffie or tranny, which are sort of abusive terms for being gay or for being gender diverse. And if they go into an upmarket supermarket, a very respectful grandmother will ask them if they've got a penis or a vagina. The same grandmother might go home and be horrified by what she asked. But unfortunately, our human condition is that when we're faced with something we don't really understand, we ask some really inappropriate questions, particularly around sexuality. And essentially, for transgender people who look in between, they have this form of abuse or inappropriate questioning carrying on for the rest of their lives. And not unsurprisingly, 40% of those who transition later physically end up trying to kill themselves. So essentially, the picture was 50% trying to kill themselves before 18 without help, and then another 40% later in life trying to kill themselves. And I would argue this is why the Dutch protocol came into being, because this was a clinic about 25 years ago in the Netherlands who'd been watching these youth and wanted to help them and do something to improve their terrible prognosis. So they started by giving young people in Tanner stage 2 of puberty. Puberty has 5 stages. So Tanner stage 2 is early puberty. They would put them on hormone blockers. And they chose Tanner stage 2 because we already knew from research that at that time, by that stage, the gender identity would almost never change. So if you were still saying by then you felt you were transgender, it was never going to go away, practically never. And the hormone blockers were life-saving. Essentially, if you give a young person who's transgender and has body dysphoria hormone blockers and the boobs won't get any bigger or the beard won't get any worse, they will not kill themselves anymore. So while they're quite expensive, certainly for us in South Africa, they are life-saving, and they simply put puberty on ice. If you stop taking them, the body carries on as it was before, and you can continue to develop. But then they had a new problem. Does one have to wait then with this almost prepubertal body until the age of 18 in order to have cross-sex hormones? But that's also not so good developmentally if all your friends are dating and having all the normal teenage changes to have to wait until aged 18. So then they started to give cross-sex hormones to kids aged 16. And they are irreversible. They cause the voice to drop if you're female to male, or and they cause body fat distribution to change. And essentially, when we look at somebody, we're all incredibly good at doing this. In under a second, we can say with a high degree of accuracy if somebody is male or female. And we're not looking at genitals, we're looking at people's faces and their body fat distribution. And essentially, that's what the hormones change. And I didn't really understand this before I got involved in it. But if you get the hormones early enough, young people will completely pass as the opposite sex. You cannot tell the difference. Yes, breasts, if they're grown, are a complication, but they can wear a binder until they have surgery. But if you get in early enough, hopefully they haven't even developed breasts. Secondly, the outcome of this so-called Dutch protocol is that these kids were doing very well, very happy and well adjusted of a mental health level of a normal, healthy population for their age. And you've got to remember where they came from. 50% trying to kill themselves. And lastly, and possibly most importantly for parents and doctors, almost none of them wish to go back to their birth assigned sex. Because even if it was 5%, I don't think we'd have the protocols in place we have today. Because doctors are very conservative. We don't want people suing us in 5 or 10 years' time for taking them down a path and then wanting to change their bodies back again. In terms of surgery, usually we don't do any surgery until 18 years old. However, top surgery or to breasts is undertaken in young people that we know well. And in South Africa, unfortunately, it is a dependent on finance. The state system, there's a 20-year waiting list for transgender surgery, even though you can get your hormones within 2 or 3 months. But for top surgery in private, you can get top surgery, and certainly we support that even in a 15-year-old if that's the most important thing. Having breasts, if you're a guy, is unbelievably distressing. These kids never go to the beach, they never swim, they are very miserable about their bodies, and that might be the most important thing, even more important than hormonal changes. The body fat distribution changes with the hormones, but so does the voice sometimes, and also hair. And all these things importantly result in a really good outcome if carried out early enough, but they are irreversible. Once the voice is dropped, you can't change it. And unfortunately, many kids miss this in trans girls where the voice has already dropped. I'm going to stop there and take questions because I also want some questions, and I see we're getting close to an hour. I've got lots more time, but I think it would be nice to take questions in case anybody needs to leave.